Hello everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I'll be talking about the best ways to lose weight after pregnancy. So if you like the video related to total health, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin this guy. For some women, that joyful time when a warm and snuggly newborn has finally arrived can be mixed with emotions about the changes in their own bodies. And many of these women have questions about how they will lose the weight they put on over the past 9+ months. Studies show that many women appear to hold on to at least a couple of pounds postpartum, and a quarter of women retain 11 or more pounds, 5 or more kilograms a year after giving birth. After having a baby, a woman retains on average 2.5 to 5 lbs, which is 1 to 2 kg, said Kathleen Rasmussen, a professor of maternal and child nutrition at Cornell University. That may not seem like much, but if a woman goes on to have more children or gain more weight for another reasons, the pound can add up, she said. Holding on to pregnancy weight can lead to serious health consequences down the road, putting moms at risk for chronic conditions like heart disease and diabetes. And losing the pregnancy weight is important not just for new moms but for babies too. Going into a future pregnancy at a higher weight can put both the mom and developing baby at risk for medical complications such as gestational diabetes and hypertension. To determine the best practices for women who want to shed the baby weight, Live Science dove deeply into the data, reviewing the best studies on postpartum weight loss and talking to key expert in the field. Ultimately, we found that losing weight after pregnancy boils down to three main points starting before you even give birth. Weight gain during pregnancy jump to section, diet and physical activity jump to section, breastfeeding jump to section for women worried about extra pregnancy pound. The expert we spoke with agreed that it's certainly possible to return to your pre-pregnancy weight, and indeed that should ultimately be your goal. Most women naturally lose much of the weight they gained in pregnancy without much effort, said Dr. Emily Oken, a professor of population medicine at Harvard Medical School in Boston. And although it's possible for women to lose all of their pregnancy weight without making major changes in their lives, the natural shift in women's lifestyle that happen after they give birth certainly introduces new challenges. It's not so much that women need to make major changes, but that they need to figure out how to fit in the healthy eating and activities they used to do, Oken told Live Science. Now, the weight gain during pregnancy. There is no getting around weight gain during pregnancy, of course, but it's important to understand how much weight you should gain, why your body is putting on pounds, and how it plays a role in what happens after the baby arrives. So, how much weight should a woman gain during pregnancy? It all depends on her body mass index before she gets pregnant. According to the Institute of Medicine, women who are considered underweight should aim to gain 28 to 40 lbs, which is 12.7 to 18.1 kg. Women with a normal BMI should aim to gain 25 to 35 lbs, which is 11.3 to 15.9 kg. Women in the overnight category should aim to gain 15 to 25 lbs, which is 6.8 to 11.3 kg. And women in the obese category should aim to gain 11 to 20 lbs, which is 5.0 to 9.1 kg. For women who are pregnant with twins, the recommended weight gain amounts are higher. And although a weight gain of 25 to 35 lbs for someone with a normal BMI may sound like a lot, certainly a newborn baby doesn't weigh that much. Those extra pounds do serve a purpose as illustrated in the infographic below. Pregnancy pound also come from the placenta, the growing uterus and growing breasts, and increased blood and fluid volume in the woman's body. And yes, added fat also weighs in. In addition, some studies suggest that gaining too much weight during pregnancy increases the likelihood of the cesarean section delivery, according to the review. While C-sections are generally considered safe, they do carry additional risk compared with vaginal birth. For example, after C-section is a major surgical procedure, and having C-section for a first birth can often lead to repeat cesarean section in the future deliveries. According to the IOM, one of the major reasons women should limit their weight gain during pregnancy is to reduce risk to the baby health. Gaining too much weight during pregnancy increases the likelihood that the baby will have a high birth weight, which can put the baby at risk for obesity and metabolic syndrome during childhood. According to a 2019 review published in the journal Expert Review of Endocrinology and Metabolism, metabolic syndrome is a combination of medical issues that include high blood pressure, a large waist circumference, and low level of good cholesterol. Finally, gaining too much weight during pregnancy also may be associated with preeclampsia. The author wrote, preeclampsia is a serious complication that can develop during pregnancy when a woman has both high blood pressure and excess level of protein in her urine. It can put both the mother and the baby at risk, but the amount of weight a woman gains should not be spread equally over the 3 trimesters of pregnancy. The IOM advises women to gain between 1.1 and 4.4 lbs, which is 0.5 to 2 kg during the first trimester. Then during both the second and third trimester, women are advised to gain 0.5 to 1 lb, which is 0.3 232 to 0.45 kg per week, depending on their pregnancy BMI. The IOM advises that during these trimesters, underweight and normal weight women gain 1 lb per week, that overweight women gain 0.6 lbs, which is 0.27 kg per week, and that obese women gain 0.5 lbs per week. So that's all about the fitness in this video. I hope you all liked it. For all of you, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. So before signing off, I would like to request you all, please do like, share, subscribe this video with your loved ones so that they will get to know better. So this is Carrie and this is signing off. Please do take care of your health. We will definitely meet in the next video with my other content. Till then, God bless you. Bye bye and take care.